One of the ways we differ is just the level of surgery we do. We do a lot compared to other places, and our focus is that surgical reconstruction.
I had spent the last 3 years prior to coming to Nebraska in Michigan at a big academic hospital, Henry Ford Hospital, and I was in charge of training the third year, so the senior residents, advanced foot and ankle surgery, and I just kind of realized that they needed more time than the short amount of time I was given during residency to train them, and that fellowship would probably be a better route to really train really high level, excellent surgeons. And then I realized that the quickest way for me to be able to do that would be to start my own.
I wouldn't have just done a fellowship just to do a fellowship. I wanted good training. I wanted someone who was actively engaged, who wanted to teach, who wanted to be involved with research. And so he was just a perfect fit. He's always kind of had that in the back of his mind of wanting to do something like this. And once he moved out here, he kind of found the perfect situation where there was good support from the local hospitals, there was plenty of case volume, and you know, I was happy to come here and learn from him and hopefully get this thing up and running and make it a premier program in the country. Ongoing education is just a really important thing, especially in medicine, and not just podiatry, but in all fields, that you need to commit to lifelong learning and always understand that there are new processes coming out, new ways you could improve, so never get too comfortable. Always push yourself and make sure that you're trying to learn the best way to treat your patients.
Better than I ever could have expected, to be completely honest. And luckily we have really good partners. We work with the surgeons out in North Platte, we work with some surgeons up in Columbus, and my colleagues there have been just tremendously supportive of the fellowship. But it's just been a great experience to bring a young surgeon, fully licensed, can practice on his own, but chooses to come and do another year of advanced training, and just to be able to see how much they grow and how much more confident they get inside of the OR has just been a tremendous asset. And I think the way that it will enhance the level of foot and ankle care in the entire Midwest, and especially Nebraska, over time is going to be phenomenal.
It's worth it, 100% for me. I think when I was first coming out, I wasn't positive if it was worth it or not, because I felt like I was very well trained in my residency program, and I think a lot of people feel like that. Once you get exposed to some things that you might not have been seeing consistently in residency, in a fellowship program, you definitely understand where your weaknesses are, where your strengths are, and what benefits it's providing for you. And I think just over the last 6 months, my confidence and my surgical skills have grown exponentially.